Good morning, everyone. It's day 286. Hard to believe. We're actually going to be entering week 42 of this, which is also hard to believe, and we're probably 19 days away from 10 months, which is also hard to believe. But sadly, I have to report two more Albany County residents passed away last night. My condolences and prayers go to the family, to all the family members, to the 196 people that lost loved ones through this tough time that we're in. So please take a moment, take a step back, and appreciate everything that you have in your life, and cherish the people around you. Because at the end of the day, that's hopefully they're around for a long time. But the reality is, if something happens to them, enjoy the moments that you have. So as of today, we now have 9,702 cases of COVID-19 in Albany County to date. We have an increase of 218 positive cases since yesterday. Yesterday was 226. The day before that was 221. And we're exactly where we thought we would be going forward as Dr. Well and I continue to watch this trend, that we would be well in the 200s. I was hoping it was going to slow down, but unfortunately it has not. There are currently 3,052 people under mandatory quarantine. Of the new positive cases, we know 27 had close contact to a positive case. 11 of them are healthcare workers. So these are things that we're going to continue to look at. And again, I was telling everyone, you have to be patient, because when we're hitting these numbers, 200, it takes time to have them chase, or to call them to let them know they're positive, which they get notified too, and start doing the mapping and tracing, so to speak. So please be patient with us. And like I said, if you really want to help us out, start writing down where you were, who you think you might have exposed, if you're around someone without a mask on, and where you visited, and anyone in your household. These are some of the basic questions our investigators are going to inquire when they talk to you, so we can try to stop the spread. So over the last 5 days, there's been an average of 200.8 new positive cases. Yesterday it was 201.2, so slightly down a little bit. As of today, 32,851 people now have completed quarantine. So I want to say that again, because we get a lot of questions. We do put out the good stuff. People are getting this. They are recovering. We do have people that are in quarantine, getting out of quarantine, doing the right stuff. But again, 32,851 people now have completed quarantine. Of those, 8,288 tested positive for the virus and have recovered, which is great numbers, 8,288. That's an increase of 359 recoveries since yesterday. So we do put out the recoveries. People are recovering from this. It is spreading. But the alarming thing is, for us, there was 18, and this is the largest number we had, new hospitalizations overnight. So we're averaging between 12 and 15 new people going into the hospital and people leaving, and thank God that they're leaving, they're recovering and moving on, and doing, getting back on the right track, so to speak. But we do have an alarming number of people going into the hospital. There are currently 110 people hospitalized from the virus. Yesterday was 107, and the day before that was 113, which was our peak. We want to continue to see the downward trend with people staying in the hospital. We don't want people in the hospital. But unfortunately, we have 23 patients that are currently in the ICU, which is another record we've seen before. And yesterday it was 23, and the day before that was 21. So these are things we continue to monitor. We continue to monitor the Capital Region hospital capacity, which Dr. Venditti and them put out all the great stats, and the Albany Med, led by Dr. McKenna, basically let everyone know where they're at. But just to let you know, our hospital bed space is stable at roughly 25%, and our ICU beds are down to about 24%. So they're the things that Dr. Venditti talked about at Albany Med, and the things we have to continue to monitor. On our control room, Dr. Venditti was talking about basically the hospitalizations bed. But one of the alarming things we've been seeing the trend here in Albany County government is the amount of people that now, for whatever reason, are getting COVID-19 and are positive. So it's like a domino effect. One person gets it in an agency, and we have to shut down 17 people. The hospitals are having the same issues with their staff, because if you know, the new matrix that the Governor Cuomo put out is based on not just the matrix zones, but it's based on not hospital beds and ICU beds, but staffing. So even though Albany Med has a great plan in place with the other regional hospitals, if they don't have the staff for the beds, it defeats the purpose. So they're having the same issues we're starting to have in different agencies, because we have agencies that have never shut down. We have an obligation to deliver services that we have no choice but to come in. Water purification has to go to work every day to make sure you can flush your toilets. They can't stay home. You know, even from your DPW workers to your garbage people to your security to mental health and health, and I could go on and on and on. They have to come to work every day, and DSS has to come to work. But we have gotten our workforce well below 45% in a lot of agencies, but DSS has been a hard one to lower that number, because obviously our applications for SNAP, housing, everything else, assistance, is really continue to really grow leaps and bounds compared to last year. People need more assistance than ever before. So the stimulus package 5 is going to be welcome to help these people. So we need workers in the building. But we have made a conscious decision. I am going down to a skeleton crew to the best of my ability with people in Department of Social Services. And I will say this to everyone: you will still get your service. We will make sure. We might have a hiccup, but I can no longer afford to have that many people into a building, and we need to address that. And that's why I said to everyone, if you can, stay home. If your companies can do what you did 9 months ago and did it by sheltering in place and basically working from home or remote, please do that. You know, help us stop this. Help us stop the growth. We'll get through it. The vaccine's here, but it's going to take time. And we have to continue to operate differently. And the way county government operated 9 months ago is, I can assure you, a lot different now with the technology we added and everything else. But the safety of the residents of Albany County are first and foremost, and the workers. And I appreciate every worker that's come in every day here. I see it on your face. I know you've been working hard, and I appreciate every one of you for what you do here for county government to deliver the services to the people of Albany County that they're used to, and continue to give that quality of service. So I do think of you every day, and without you, we can't make services possible. So being smart, please wear your mask, cough into your hand, or your arm, excuse me, clean your hands, stay 6 feet apart. We'll get through this. We're going to get through this. The vaccines are getting through our nursing home. We get them Wednesday. Other nursing homes are getting them around the 26th. I actually was just talking to County Executive Steve McLaughlin this morning. His nursing homes are looking at the end of the month. We're going back with some stuff back and forth, so please keep that in mind. What's alarming is that and it's hard to believe with the holiday, the national news today reported that airports across the country are seeing an increase in traveling. I don't know what people didn't learn about Thanksgiving when they went out, and why we're in the situation we're in. And we need you to do the right thing and stay home. I just talked to the CEO of the Albany International Airport, Phil Calderon, and he's actually encouraging people not to travel. And for a CEO of an airport to say that says a lot. And I said, Phil, what's it look like? And he goes, you know what? We're probably looking at about 1,000 people today, and the numbers are really low. So we're not seeing what's going on a national level here in the Capital District as much. But typically, they get 6,500 people on a daily going through the gates at Albany International Airport. And obviously, at the travel time of the holiday, it's more. So I'm not happy we're seeing 1,000 people, and I don't think Phil's happy, because the only way we're going to get through this is if we work together. I know people have COVID-19 fatigue. I know you're tired. My staff's tired. Everyone's tired. People are a little bit crankier. It's the holidays. It's time to take a step back and appreciate the things around your life that you have, and they're the good things, and stop focusing on the negative stuff. And we'll get through it. People should continue to get tested. We encourage that, whether you have signs or symptoms. I worked out, we're getting more testing. That announcement will be next week, the partnership that we announced, and we're going to bring it to you. The mobile testing sites were a huge success. We're one of the first ones to do it in the state, but we couldn't get people to come there. It was hard to get people to come to the mobile testing sites. Now we're going to come to your door. We're going to make it easier on you, and please stay tuned for that. And I'm working out the logistics, and it's a lot of partnerships, but we're going to make this happen so people can get tested, make it convenient, and make it simple. I don't know what else we can do, and we're not going to charge you for it. We're going to pay for it in the county. Going back and forth with Chairman Andrew Joyce, we're going to figure this out. And money can't be the issue for someone's health or to get through this health crisis. So working with the Albany County Legislature and the other partnerships I got going, we'll get this done. If you do need to get tested, please, the Times Union Center will be on tomorrow instead of Friday, like I said before. Whitney Young is going to be at the Watervliet Administration Building. If you need to get tested, or you feel like you just want to get tested, please call 518-465-4771. We pay for it. If you don't have insurance, we'll cover the cost. And also the state of New York, and I know I keep saying this, and somebody kept, why do you bring it up? Because obviously there's still people out there that don't realize if you don't have insurance, we'll either pay through it for Whitney Young, or Governor Cuomo set it up across the state where you can go get free testing and they don't charge you. You don't even take your health care, even if you have health care. So there's places available. And we can make this happen. So no one should have to worry about paying for this, I mean, not at these difficult times. So you can call the state to schedule an appointment at 1-888-364-3065. And again, our great partners with Price Shoppers, CVS, Purdy One, Walgreens, and plenty others I could continue on. Go to our website at albanycounty.com to see what testing sites are available or closest to you for kids and all that. We get them questions still today. That's why we developed this. Please take the time to go to the website, and you can see where you can bring your child, or you can bring your mom or dad or your loved one, and the times that you're going to have to wait. And again, it's holiday, and we tend to see more people at the holiday time trying to get tested. So yes, there's going to be a backup, and it's going to take you a while to get tested, and you just got to keep that frame of mind. I want everyone to celebrate the holidays. I really do. We if we have Hanukkah, Kwanzaa, Christmas coming up on Friday, New Year's around the corner, and you know what? It's been a tough 9 months on everybody, and I realize that. And I've made the conscious decision with my staff, not unless something gets so far out of the whack these next 2 days, not to do a briefing. We'll put a press release out. Not unless something if you hear from me Thursday or Christmas morning, it's just going to be because I have no other choice. But the reality is this: I want people to take a step back these next couple of days. It's the end of the year. Enjoy what's around you. Enjoy your loved ones. And if you don't have anyone you love, enjoy being with yourself for the next couple of days. I know we all need a break from the COVID-19 press conferences and then stuff putting out and negative, as people look at it, negative stuff coming at them. It's our job to educate you. It's our job to let you know what's going on. It's my job just to give you the facts, not my opinion, to tell you how it is and how we're reading it from the World Health or CDC or Governor Cuomo or Department of Health or whoever we're dealing with to put that information out there. But my challenge is this to everyone. I still want you to do the right thing. I'm not telling you. I know we have COVID-19 fatigue, but here's a challenge to the viewers out there and to listeners. You know what? Take a break. Stay home. And enjoy everything in your life and think of the positive stuff. But if you do go out, wear your mask, cough into your arm, clean your hands, stay 6 feet apart, and don't have large social gatherings. We know there's a whole movement of people having house parties and getting together. I'm asking you, please don't. If you want to get through this until this vaccine gets out, it's only going to get worse. And I don't want to report another Albany County resident passed away or someone else is in the hospital or the ICU. We have 3 people under the age of 25. I stopped reporting whether or not they have health conditions or not, because that's all people want to hear. Well, they had health. Underlying health condition could be diabetes. It can be something small like high blood pressure, right? The last couple of people we had in their 50s had no underlying health conditions. And I'm not trying to scare people. I'm just trying to put the facts out there so you can educate yourself. So you can be part of the solution, not part of the problem, and we can get through this together. So please, these next couple of days, I am going to try not to put stuff out there that I don't have to, and I want people to take a break from this. Enjoy your neighbors, enjoy your family, enjoy your co-workers, take some time. I am going to shut county government down to a level that's never been shut down, even 9 months ago. I am going to go to emergency status in the county where I have limited skeleton crews to the best of my ability to keep people safe. Because again, what Dr. Venditti was saying it's spreading, and we're having the same effect here with our workers. And I want to protect them as much as I want to protect residents. But I still have to deliver services. I still have to do certain things. So please, to the viewers and listeners, be patient. It's gonna, you're still gonna get whatever you need, and no one's gonna be who's homeless. You're gonna get shelter. People that need food, I can assure you as hell you're going to get your food, and you're going to be taken care of, and you're going to get clothing if you need it. You're not, though it just be a little bit slower process, and just give us time so I can protect my workers just as much as I'm trying to protect the residents. Enjoy the holidays. Enjoy the time that you have with people in your lives. And if you're mad at somebody, my wife said this to me, spread love, not hatred. And you know what? I'll say a prayer for the person that just wants to be negative all the time. I'm just trying to put the facts out there. So please take a step back. It's a marathon, not a sprint. We'll get through it. We're almost through it. I know it feels like we're going to hell and back, but we'll prevail. We always do. So if you need mental health support, please call the number. It's available 7 days a week, 8 a.m. to 5 p.m., 518-269-6634. And our 24-hour sexual assault hotline number, 518-447-7716. Our partnership with United Way, 211, and New York State hotline, 188-364-3065. And again, please just wear your mask. We'll get through this. Stay healthy and safe out there, and do the right thing.